Hello, my name is Sydney Marara, and I will be presenting as part of Capella University's NUR-4030 class, Remote Collaboration and Evidence-Based Care. Thank you for joining me today. In this presentation, I will propose an evidence-based plan to improve outcomes for our patient, a 25-year-old transgender male with gender dysphoria, living in a rural area with limited access to healthcare services. This plan is guided by the Knowledge to Action model, which provides a structured approach to translating evidence into practice. I will also explore the benefits and challenges of remote collaboration in designing and delivering his care. Introduction to the case. Our patient has been diagnosed with gender dysphoria following a behavioral health evaluation conducted by his healthcare provider, Dr. Smith. The patient has expressed a strong desire to pursue both hormonal and surgical treatments to align his physical appearance with his gender identity. However, rural residency and limited access to specialized healthcare create barriers. Remote collaboration with a multidisciplinary team, including nurses, mental health professionals, endocrinologists, and surgeons, is necessary to create a patient-centered care plan. Research has shown that a collaborative multidisciplinary approach improves access to and quality of care for transgender and gender diverse patients, particularly those in rural areas. Coyne et al. 2023 and Poquiz et al. 2021. Applying the Knowledge to Action model. This model is a systematic framework for bridging the gap between research and practice. It emphasizes feedback and adaptation, which is particularly important when designing care plans for complex cases like this. The Knowledge to Action model has two main components: the knowledge creation funnel and the action cycle. Knowledge to Action framework, ND. Knowledge creation. The World Professional Association for Transgender Guidelines 2022 Surgical Treatment Updates, which provides standards for hormonal and treatments by Lai and Johnson 2022. Increasing access to care for transgender or gender diverse youth using telehealth, which demonstrates the role of telehealth in bridging rural care gaps. And gender dysphoria, optimizing healthcare for gender and diverse youth with a multidisciplinary approach, which underscores the importance of comprehensive team-based care for transgender individuals, by Russell et al. 2021. Within the action cycle, we want to identify the problem, which is limited access to healthcare affirming care for rural patients with gender dysphoria. We want to adapt knowledge to context, so tailoring evidence to the patient's rural setting, emphasizing telehealth solutions and local resource integration. Implement the interventions, so we will collaborate with a multidisciplinary team to implement hormonal therapy, mental health support, and surgical preparation. And then we monitor and evaluate using remote follow-ups and patient-reported outcomes to assess progress and refine the care plan. By following the KTA model, the team can ensure that evidence-based interventions are effectively integrated into practice, resulting in improved patient outcomes. So this is the proposed evidence-based plan. Using evidence synthesized through the KTA framework, I propose the following care plan. Step 1, comprehensive mental health evaluation. The first step is a detailed psychiatric evaluation to confirm the diagnosis and assess readiness for hormonal and surgical interventions. As highlighted by the article, Gender Dysphoria, Optimizing Healthcare for Transgender and Gender Diverse Youth with a Multidisciplinary Approach, by Coyne et al. 2023. Comprehensive mental health assessments are foundational to gender-affirming care. Nurses play a critical role in coordinating evaluations, providing counseling, and supporting the patient throughout this process. Step 2, hormonal therapy. Based on the WPATH guidelines, testosterone therapy is recommended to alleviate gender dysphoria and improve quality of life. Nurses will monitor lab values, educate the patient about potential side effects, and ensure adherence to the treatment plan. Lai and Johnson, 2022. Step 3 is surgical preparation. Following a successful hormone therapy, refer the patient for chest reconstruction surgery, a procedure with high satisfaction rates among transgender men, according to Pop Quiz et al. 2021. Remote consultations with specialized surgeons, as discussed in the article, Gender-Affirming Care in the Midwest, Reaching Rural Populations, can expand access to rural patients, by Pop Quiz et al. 2021. Step 4 is remote monitoring and telehealth integration. Insights from the article, Increasing Access to Care for Transgender and Gender Diverse Youth Using Telehealth article, emphasize the value of telehealth in bridging gaps in rural healthcare. Virtual follow-ups will allow nurses and other providers to monitor the patient's progress, address concerns, and maintain a continuity of care. Russell et al. 2021. And then the local resource integration. Nurses can coordinate with local clinics to provide routine lab work and counseling, reducing the burden of travel for the patient. Leveraging telehealth for communication with local providers ensures seamless care integration. Russell et al. 2021. The benefits of remote collaboration. Remote collaboration has been instrumental in overcoming geographic barriers to care. The multidisciplinary team shared expertise through virtual meetings and developed a cohesive plan tailored to the patient's needs. The benefits include increased access to specialists, as demonstrated by Russell et al. 2020 Health. Telehealth connects patients to all of the specialists. Timely decision making. The remote communication enabled a quicker evaluation treatment planning compared to traditional referral process, which is essential in addressing the unique needs for transgender patients. Virtual communication enables that faster treatment and reduces delays associated with those traditional referral processes. And then the patient-centered care. Virtual consultations allow the team to maintain a consistent connection with the patient, fostering trust and, again, continuity of care. The challenges. While effective, remote collaboration presents challenges. There's technology barriers. Limited internet access in rural areas may hinder the patient's ability to participate in virtual appointments. Nurses can advocate for the use of a hybrid care model to mitigate this issue. Coordination of care. Scheduling meetings across multiple time zones can delay treatment planning, and tools such as asynchronous communication platforms can streamline this process, meaning that they can book on their own. Lack of hands-on interaction. So physical assessments are difficult to conduct remotely, which may delay the identification of complications or side effects. But collaborating with local providers for in-person assessments can address this gap. Providing evidence-based care for rural transgender patient with gender dysphoria requires a multidisciplinary patient-centered approach supported by remote collaboration. Guided by the Knowledge to Act model, this plan incorporates mental health evaluation, hormonal therapy, surgical preparation, and ongoing support to optimize results. Remote collaboration enhances access to specialized care, while local partnerships address logistical challenges. By leveraging evidence-based practices and addressing barriers to care, nurses can play a pivotal role in improving health outcomes for underserved populations. The evidence, reflection on evidence of best practices. The WPATH guidelines provides a comprehensive roadmap for surgical and hormonal treatments. The article by Coyne et al. 2023 highlights the value of multidisciplinary collaboration, while Russell et al. 2021 and Poquiz et al. 2021 underscore the feasibility and effectiveness of telehealth altogether. In conclusion, providing evidence-based care for patients with gender dysphoria in a rural setting requires a thoughtful, multidisciplinary approach. The proposed plan emphasizes a comprehensive mental health evaluation, hormonal therapy, and surgical preparation, all supported by ongoing virtual collaboration. Thank you for your attention, and I look forward to any questions or feedback on this proposed plan.